Most people with lupus develop some kind of skin problems during the course of their disease, and painful ulcers or sores that appear in the mouth are one of the most common. These ulcers may also develop in the nose, vagina, eyes, and anus, mouth. Oral and nasal ulcers are one of the symptoms doctors look for when diagnosing lupus because they appear in 25% to 45% of people with lupus. 1 to 3rd, you may also see these sores called mucosal ulcers because they appear on the mucosa, the skin membrane that lines cavity in the body. What do these mouth sores look like? There are 2 types of lupus mouth sores. The first type is usually painless and looks like a raised white bump surrounded by a reddish line. The second type is sometimes painful and appears red with a white halo or white lines around the sore. Some people say these ulcers feel like a canker sore, the type of sore you get from accidentally biting the inside of your cheek, or like burning the roof of your mouth on hot food. Lupus mouth sores tend to develop on the roof of the mouth but can appear anywhere. Nose ulcers most often appear on the septum, the wall dividing the left and right nostrils. What causes mouth and nose ulcers in lupus? These sores may appear during lupus flares along with joint pain, rashes on other parts of the body, and hair loss. In some people, stress or being overtired may make mouth ulcers worse. In others, mouth ulcers are a signal that a flare is coming. These sores may be triggered during a severe flare, the hormonal changes of pregnancy, when you are low on vitamin B12 or iron, or when you take NSAIDs or beta blockers. The good news is that mouth ulcers tend to go away when the flare subsides. How are mouth ulcers treated? These sores can be quite uncomfortable or painful, but are not usually dangerous to your teeth. Treatment for mouth and nose ulcers include antimalarials and steroids to control all of your lupus symptoms, including mouth and nose ulcers. A special mouthwash or toothpaste to help mouth ulcers heal more quickly. A pain-killing spray, mouthwash or gel such as Oragel or a base or Anbisol for especially painful ulcers. Steroids, nasal sprays for sores in the nose. Other tips for dealing with mouth ulcers. There are several things you can try to either help prevent mouth ulcers or help them heal once they appear, including use a soft bristle toothbrush to avoid irritating the gums. Eat soft food and avoid rough, crunchy foods like popcorn. Get regular dental checkups. Avoid very hot or acidic drinks such as hot tea, coffee, or orange juice. Avoid very spicy, salty, or acidic foods. Do not chew gum. Foods to avoid. Certain foods are known to increase the risk of developing mouth ulcers in some people. These goods include chocolates, coffee, peanuts, almonds, strawberries, cheese, tomatoes, wheat flour. It may help to keep a food diary to identify which foods make your mouth more sensitive or seem to be connected to sores cropping up after eating. The Cares and Cures team want you and those close to you to live a healthy, happy life. Your health is a valuable thing. Look after your health and your mind so that you can live your life to the fullest. Remember, you only get one. Please share this with your friends and family and do let us know what do you think in the comments below. This video is solely for informational purposes. Do not self-diagnose or self-medicate, and in all cases consult a certified healthcare professional before using any information presented in this video. The tutorial board does not guarantee any result and does not bear any responsibility for any harm that may result from using the information provided in this video.